the tragedy of COVID was that of all those people who died in nursing homes, only some 10% in Scotland, when they published the data in June, actually got into hospital. And I think that's a terrible figure, because in England it was much higher, it was around 26%. And we know what was going on in these care homes. The GPs weren't going in, they were doing Zoom calls. The staff were underfunded and overworked and very frightened. They were also bringing in a lot of agency staff. And there were high vacancy rates of 20 to 25%. And that was before COVID struck. And the vacancy rates were even greater afterwards.
The quality of that care and the treatment of their employees in this monopolised market is absolutely shocking. And nothing has brought that to light more than the coronavirus scandal that we've been living through. Nearly 2,000 residents died in privately run residential care homes this year. And there was a clear correlation between the private ownership of those care homes and high rates of COVID death.
Two in particular are run by HC1. HC1 paid a dividend of £45 million to their shareholders last year, yet seem unable to keep their residents or clients safe, or indeed their staff safe for that matter.
Over the last 20 years, that's the bit that's been forgotten. It's the dignity of the people that are providing it. At the point now, I have 3 adult children. It would break my heart if one of them went to work in social care, because I know what it's like. I want better for them, and I never thought I would say that.
No, it's exactly like every miner used to say about their laddie. They never wanted a laddie of theirs going down the pit. It was dangerous, it was badly paid, and there was got to be better jobs up ground. I mean,
if we look at that human rights catastrophe of older people, denied hospital treatment when they should have been hospitalised, having DNR notices, do not resuscitate notices, put upon them without their knowledge or their family's knowledge, staff denied PPE, residents denied testing, and that madness of discharging people untested into the care home sector to allow the virus to run rife.
And Derek Feely recommends the establishment of a national care service, but virtually in name only. The establishment of a national care service, but he recommends that there's a care minister to sit in the cabinet next to the health minister. He recommends the appointment of a highly paid chief executive for that care service on the same salary as the chief executive of the NHS, which he used to be. He recommends the appointment of 6 chief operating officers, also on handsome salaries. And that's it. That's it. Nothing about it should be free at the point of need. Nothing about it should be publicly owned and run. Nothing about this is a service that, instead of being a national scandal and an embarrassment to the people of Scotland, should in fact be a world leader and something that we are the envy of the world about.
The private care model creates a stratified system with care quality and care provision distributed on the basis of wealth and not on need. And sometimes those with the greatest need and the least ability to pay are just given inadequate levels of care. That profit model devalues people's lives, the lives of elderly and vulnerable disabled people.